I am Dr. Gretchen Hawley, a physical therapist and a multiple sclerosis certified specialist. So what that means is that I specialize in helping people with MS get stronger, walk better, and make your daily activities feel easier through functional exercise and strategies to not just strengthen your muscles, but also your brain and the connection between your muscles and your brain, which are your neural pathways. So I partner with MSCS and News, where every month we offer a virtual support group called Moving with MS, and we pick a specific topic related to physical therapy, and I just share tangible tips, tricks, exercises, strategies that you can start implementing right away to help with your MS. So if you are tuning in live, say hello and let me know where you're tuning in from. I already see Kathy says hello from Arizona. Maria says hello from Miami. Welcome, welcome. Today's topic is how to track your progress. And this is really important because as we're exercising, especially with something like MS, it's going to be important that we know how we are doing. Are you improving? Are you regressing? Are you maintaining? Somewhere between any of those. And it's also going to be really important for not just you to understand that, but for your healthcare team as well. And as you may have experienced, with MS, you often don't get to see your providers as frequently as you might like. And so while you can go to your providers for the tracking, there's also a lot that you can do at home to keep you motivated until the next time that you see them. So we're going to review all of that today. So again, this is our Moving with MS virtual support group with MSCS and News, and a huge thank you to our supporter, Viatris. All right, so I titled this slide deck Functional Outcome Measures, which is kind of a fancy term of saying tracking your progress. In the physical therapy world, the way that we track progress is through outcome measures. And you might not know that you've done these before, but you've likely done these before. So we're going to review exactly what they are, different types, and show you examples. And I'm going to do some demonstration so that you can see exactly how you can do these at home. Okay. I see Kevin says, congrats to the Bills Mafia on last night's win. Yes, what an insane win, if anyone watched. Okay, so what are functional outcome measures? Functional outcome measures quantify a patient's improvement of function throughout an episode of care. Physical therapy outcome measures allow therapists to create definitive baseline of patient ability and compare advancements in function in real time. This is so important for a few different reasons. First and foremost, your goals. By tracking these functional outcome measures, we will clearly be able to see, are we having an effect on your function? Not just, can you do more repetitions, or can you do more sets, or can you do a harder variation of the exercises? That's not necessarily what we're talking about. That's great to track as well. But what we were talking about in functional outcome measures are your daily functions, or a better way to explain it might be your daily activities. Are those things getting easier because you're getting stronger or reduced fatigue? And then the second reason this is really important is for insurance, especially if you're seeing an in-person physical therapist. They need to be showing your insurance company via their documentation and their notes on you and your sessions if you're making functional improvements. So my question for you is, how often do you see your neurologist? So let me know. I'm going to pause for maybe 30 seconds or so here to give you some time. How often do you see your neurologist? I love asking this because it's so different for each person. I know I have lots of members and clients who see them every 6 months, some once a year, some twice a year. And then there's some people who just say, whenever I call them, whenever I need, and it might be several years before they see them. So I'm curious what you guys have to say. Maria says once a year. Michelle also says once a year, yearly. Kathy says 6 months. Vicki, once per year. I've been stable for 16 years. Amazing. Dion says twice a year. Linda's every 6 months. Deb, Monica, Joe, Mishika, Michelle, all of you guys all say twice a year, so every 6 months. Interesting. Okay, so far everyone here, it's either twice a year, so every 6 months, or annually. 6 months, 2 times a year, if you don't count MS. Okay, so the reason why I like to ask this is because one of the healthcare providers that can do these tests are neurologists. But if you're only going every 6 months or once a year, how are you supposed to know in the meantime if your exercises are helping or not? And I don't know about you, but I am someone who I need to see data showing that, yes, this is working in order for me to stay motivated and consistent. So the clinicians who measure your progress through these functional outcome measures, first is neurologists, and I'm going to give you a ton of examples. And when I give you those examples, you'll be able to say, oh yes, I've done that with my neurologist or with my physical therapist. Physical therapist is another one. Occupational therapist. SLPs are speech and language pathologists or speech therapists. Pretty much any therapist that you see should be doing functional outcome measures, and neurologists as well. Your primary care physicians tend to not do these as much, but when it comes to MS management, everyone managing your MS might have different functional outcome measures to track, but they're all going to be important. So there's 2 different types of functional outcome measures. The first type is subjective, and the second type is objective. A really simple way to understand what these are is subjective is written almost like quiz-like. So there's questions, and I'll give you examples, but there's questions written down and you answer those questions. It's based on what you feel and what you think is happening and is true for you. Whereas objective is measured, it's timed, usually with a stopwatch or counting. There's an actual number involved. So we're first going to review subjective outcome measures. And these are the 2 that are most common for the physical therapist. The first is Multiple Sclerosis Walking Scale 12, and the second is Modified Fatigue Impact Scale. Let me know in the chat area if these sound like something you've done, and then I'll ask you that same question again once we review them, if you have actually done them or not. Do you think you've done the first one can be abbreviated as MSWS12, and the second can be abbreviated as MFIS. So we see Dion says yes. Vicki has said never heard of this. Okay, so that's good to know. And before we go on, just so you know, you of course can print these and do these at home, but if as we continue reviewing these today, if you feel that your physical therapist or maybe your neurologist are not doing these tests on you, ask them. They should be. So you don't shy away from saying, hey, can you give me the MSWS12? Or can you give me the Modified Fatigue Impact Scale? And then they can write that in their notes, especially if your physical therapist is having a hard time getting you more physical therapy sessions. Now, sometimes it's really out of their control and your insurance company just gives you 8 visits no matter what, even if you're making good progress, but you never know, and it could be helpful. Linda says she's never done these. Renee says she has. Michelle says she doesn't think so. Maria did the MSWS 12 years ago. Do you do both in your online program? Yes, we do both. We have both of these in my online program, the missing link. I've done the 25-foot walk test. Okay, so let's go. I'm going to go into further details about what these 2 subjective ones are. So remember, subjective means quiz style, you're rating yourself. So this first one is the MSWS 12. So there are 12 questions, And they are asking you on this left-hand side, in the past 2 weeks, how much has your MS ... and fill in the blank. And then you rate it between not at all, a little, moderately, quite a lot, or extremely. Now, not all of these will apply to you, in which case what I always tell my clients is if something doesn't apply to you, such as, let's see, there's one, where did it go? Slow down, effective. There's one about climbing stairs. If you never have to climb stairs, then I would just rate it a 5. Or if you, where did the other one? Limited how far you're able to walk. Run, here it is. Limited your ability to run. If you just never run and you don't think you'd ever be able to, you'd rate it a 5. So let's go through some of these, but you can see here, what all of them are. So in the past 2 weeks, how much has your MS limited your ability to walk? Not at all, a little, moderate, quite a lot, or extremely. In the past 2 weeks, how much has your MS limited your ability to run? In the past 2 weeks, how much has your MS limited your ability to climb up and down stairs? In the past 2 weeks, how much has your MS made standing when doing things more difficult? How much has your MS limited your balance when standing or walking? Limited how far you're able to walk? Increased the effort? So the idea is that you fill this out about every 30 days or so. Some people fill it out every 2 weeks, some people fill it out once a month, some people fill it out every other month. So it's honestly up to you if you're doing this at home. I generally recommend every 30 days. Now with MS, you might not see any change that soon because, as we all know, it can take many months to see progress, but it can't hurt. And I would suggest that you don't assign any, how do I want to phrase this, value or worth to these. They're just numbers, and it's just data that is meant to help us understand what may or may not be happening. So this is something that you'd fill out. It's obviously specific to your walking. Now, the modified fatigue impact scale, I believe I just chose one picture here, but there's actually 20 questions. So we're missing a few here, but it's the very similar concept. Because of my fatigue during the past 4 weeks, fill in the blank. And you're filling in, does this never happen to you? Rarely, sometimes, often, or almost always. So I'll read a few. Because of my fatigue during the last 4 weeks, I have been less alert. Because of my fatigue during the past 4 weeks, I've had to pace myself in my physical activities. Because of my fatigue during the past 4 weeks, I have had trouble maintaining physical effort for long periods of time. Now, one thing that I really like about the modified fatigue impact scale is that it doesn't just ask about physical questions, it also asks about mental fatigue. For example, because of my fatigue during the past 4 weeks, I have had difficulty making decisions. So this number 11. So the way that, well, let me back up for a second. The way that the MSWS-12 works is you just add up all the numbers and that total is your score. Whereas with the modified fatigue impact scale, you could do the same thing, just add everything up and this is what your score is. Or on the final page of this, it does tell you which of these numbers to add up to get what your physical fatigue score is, and then which numbers to add up to see what your mental fatigue is. And then there's a third category as well. I believe it's, what is it? Physical, mental, it's something with a combination of the two. So it might say, add up scores 1, 6, 10, 15, 17, 20 for your physical. And so you can, I really like that because sometimes your mental fatigue is fine, but your physical fatigue is where you're really struggling, but you can keep track of both categories. So I really like this one, and it's not just me liking it, there's actual MS specific research showing that the two best subjective outcome measures are the MSWS-12 and modified fatigue impact scale. So that's why we're reviewing these ones today. Let's see, Mishka says, I have been taking PT in person and have not seen these. Okay, so this could be something that you ask them to do. What if you're in a wheelchair? Do these apply? I don't know if that was for the Modified Fatigue Impact Scale or MSWS 12, but yes, if you are in a wheelchair and you never walk, so therefore none of these apply. There are other tests you can do. I'm blanking on what it's called. I'm gonna kick myself later for it, but there is one that would be more appropriate for you to do. If you're looking at this and just saying, yeah, I can't do any of these, then it's not going to be the best one for you because it's likely gonna stay the same. So there is another one. If there's time at the end, I'll do a quick Google search and see if I can find it. Good question. Will printable copies of these be available? I can send printable copies to Jennifer. But if you Google MSWS 12 and Modified Fatigue Impact Scale, these will pop up in some of the first searches, but I can send them to Jennifer as well. I'm scheduled to do this assessment this week. Awesome. Okay, so moving on to objective. As you may recall, objective is timed. So if you're doing this at home, you're going to want your phone or a stopwatch nearby, ideally someone to help you with the timing, just so you're not doing the timing and the test at the same time. But we're going to review several of these. So let me know which of these you have done, whether it be with your neurologist or your neurologist team or your physical therapist. Some of these are very common, others not so much. So the timed 25-foot walk test, this is a big one. Also, let me just reiterate, these ones at the very top, these 1, 2, 3, 4, these 5 have been shown in MS research to be the most effective and pick up on the differences the best for people with MS. The ones at the bottom, with the exception of the 9-hole peg test, not as much. So the timed 25-foot walk test, the 2-minute walk test, or the 6-minute walk test, the timed up and go, the 5-time sit to stand, and the 30-second sit to stand. These are going to be some of the best ones to specifically assess your walking for some of these, your endurance for some of these, or your strength for some of these, and we'll go through each one. Others just to be on the lookout for that you might have done with your physical therapist is the dynamic gait index or the Berg balance test. The Berg balance looks at balance. The dynamic gait index gives you, I believe it's like 15 or 20 different activities that you need to do, and it's related to walking. So it asks you to walk while turning your head, and you're rated on how much do you stumble. And then it asks you to walk and then step over an item. How much did you stumble with that? It asks you to walk and take a step up and then a step down. How much did you stumble? So that's more of the dynamic gait index. And then the 9-hole peg test. This is a super common one for occupational therapists and neurologists. So I feel like a lot of you have probably done that one. We're going to go into specifics for these top 5. But before I do, let me just take a peek at the chat, see what you guys are saying if you've done these. How do you consider other health issues when completing these? We will get to that in a bit here. Dion has done the timed up and go, the sit to stand, and the 25-foot walk test. Awesome. Okay, so let's review. Timed 25-foot walk test. So in the clinic, the way that this is done is they usually have a piece of tape or a marker at one end and a marker at the other end that is 25 feet. And you start at one end already standing with or without your mobility aid. You walk down the 25 feet and then the timer stops. And then usually you'll do that 3 times and you'll take the average. But let's discuss, do you have a preference of if I demonstrate as we're talking about each one, or just quickly review them and then do all the demonstrations at the same time versus going back and forth? Let me know. I've never done these. These are great. Yeah, Mindful peg test, I've done it with a neurologist, yeah. No preference as you're reviewing. All right, we'll do it as I'm reviewing. Okay, so we're currently talking about time 25-foot walk test. Again, if you're at your neurologist or physical therapist clinic, they've got that piece of tape, you walk from one end to the other. Now at home, would it be nice for you to have a piece of tape that's 25 foot long? Yeah, and could you do that? Have I had patients who have done that? Yes, but you don't need to. So this is how I modify the times 25-foot walk test at home. So I'm gonna back up here. Okay, I actually have my canes right here. I'll use one. So when you're doing this at home, and one thing that's really important for all of these tests that we're about to discuss is to use 2 immovable objects. I wouldn't necessarily want to, for example, I wouldn't necessarily want to use this chair if I think that I'm ever going to move it. If I think it's always going to stay in that place, then okay, I can use it. But I really like using items that don't move, like a closet over here, and what is just out of shot is a window. See those curtains right there? So that's not going to move. So the way that I like to use that for the 25-foot walk test is I'm going to walk from that wall to this wall. Is it 25 feet? No. But at home, it doesn't necessarily need to be 25 feet. We're just using this distance as a way to track how we're doing. So I would start over here with my timer, or someone else is timing me. So I'm at my wall and someone presses go, and I'm quickly but safely going to walk all the way over to this part of the wall. And then I'm going to stop and regroup. Someone presses the timer, I walk, and someone stops. Now we would want to measure this if you're able to, just so we have an idea of what that distance is. But the way that you're documenting this for yourself is this, I call this room my office. It's really a bedroom that I turned into my office. But I would say that I did this test in my upstairs office from the window to the closet. And that's how you can make sure that you repeat the same thing next time. So you do that 3 times and then take the average of how long it took you. Okay, so the 2 or 6 minute walk test. Now, research shows that, or used to show that the 6 minute walk test is going to be the most effective. But not too long ago, maybe 8 years ago, newer research said that actually the 2 minute walk test is also okay. So if your patients cannot walk for 6 minutes, that's okay. They can do the 2 minute walk test. And essentially what you do is you just walk for 2 minutes. Now, if you're doing this at a neurology clinic or a physical therapy clinic, typically what this looks like is if they have a big loop, then they generally know how long, how many feet or yards one loop is. And they start their timer and they have you walk for 2 full minutes, and then they look down and they write how many feet you went, how many yards you went, however distance you went, and then that's what you're going to be comparing it to next time. If they don't have a loop, they might have a really long hallway and they know how far it is down once, and then of course back, you would just multiply that by 2. So they will count how many times did you go down and back. So that's generally how you would do it in the clinic. Technically, they should also be taking your blood pressure and your heart rate at the same time. So they're not just getting a sense of how far are you walking, but how is this affecting you? Are you getting super fatigued? Not so much fatigued? Is your blood oxygen maintaining? So that's how it would be done in the physical therapy clinic. At home, kind of similar, but let me demonstrate. So at home, the reason why I say kind of similar is because you still want to pick either 2 items that don't move or a pathway that will never move. So I could start my timer for 2 minutes. I could start over here, press go, and I'm just gonna walk here, down, turn, and back. That's 1. I'm gonna keep going, down and turn. That's 2. But I don't know about you, I would get very dizzy doing that for a full 2 minutes. This is not that long of a distance, so theoretically, I would be able to do that quite a few times. But it is one option. The other option could be if you have a circle in your home or a long hallway, then you can start at one end of the hallway, walk to the other end, and just go down and back. How many times were you able to do that? You can measure it if you want to know the distance, but when you're doing it at home, you don't necessarily have to know. You could just document it as down my downstairs hallway 3 times. And then next time it might be 3.5. The faster you get or stronger you get, it might be 4. So you could just document how many times you do it, the loop or the hallway, or if you're into numbers, you could actually measure the distance yourself. You want to try to make sure that you have as few obstacles as possible. For example, in my home, I do have a circle that I could do downstairs, but there's a ledge. So it would require that I step up on a ledge, keep going the circle, step down, step up, and steps, of course, can be challenging. And so I'd want to keep that in mind. Instead, maybe I would just go around the perimeter of my living room where I can do that without running into furniture and therefore have no obstructions in the way, no obstacles in the way. I will say, admittedly, that one is the one that I do least because it tends to wear my patients out a lot, and there's other testing that we can do that might even be more important than what is your endurance. With that said, I'm actually going to skip forward. We'll come back to the timed up and go. There's newer research as of this year saying that the 30-second sit to stand can be equally as effective in the data that it gives us to the 2-minute or 6-minute walk test. So I love that that came out because the 30-second sit to stand is so much easier to implement in the clinic, but also at home, and it's also less fatiguing for you. So let's review these ones first. There's the 5-time sit to stand or the 30-second sit to stand. And what these look at is your leg strength as well as leg stamina or endurance, especially with that 30-second sit to stand. They look the same in the clinic as they do at home. So let's review what that's going to look like. Okay, so you would want to use a chair that has 0 wheels, doesn't swivel. I don't happen to have one right now in my room like that, so I'm going to use this chair. It does swivel. It's not going to be the best, but it'll show you what I'm talking about. So for the 5-time sit to stand test, you're going to sit in a chair and you can set yourself up for success, meaning put yourself in a position where you're going to be able to stand up easier, meaning you don't want to start all the way back here because then you're going to waste time scooting forward, separating your knees, getting into the good alignment before you can even stand up. So do yourself a favor, get into a position at the edge of your chair, feet wide, knees bent. Then either you or someone else is going to start the timer. You can use the armrest. You're going to stand all the way up and then sit down. And you're going to do this 5 times. And then you're going to look at that number, stop the stopwatch, and see how long did that take you. Write that number down. The 30-second sit to stand is where you're going to count how many repetitions you're doing. So you're not counting 5 times. You press the timer and someone is watching for 30 seconds and you're going to write down, I did 7 in 30 seconds or 15 or however many it might be. So those are two different ones. If you're able to do the 30-second sit to stand and you don't want to do both, you want to get your biggest bang for your buck, I would do the 30-second sit to stand. That's going to be the one that gives us a sense of your strength and stamina, whereas the 5-time sit to stand is more so just strength. Another thing to note about that one is when you're documenting this for yourself, because you're doing it at home, is to write down what chair you used. Write down, did you use armrests or not? If so, did you use armrests for every repetition or just half of them? You want to get really specific because you likely know this, but it can take a while to see progress when MS is involved. So if let's say you did the 30-second sit to stand, and let's just say you did 11. If your goal is to do 15, it might take months to get to 15, but it might take only a week or two to still do 11, but you only used the armrest for half instead of all of them. Or if you were on a taller chair, taller chairs will make any sit to stand exercise easier. So you might still be able to do 11, but it's on a lower chair. So that's going to be harder. So that's why it's really important. And I have a slide here in a second that'll write this out for you, but it's really important to document those types of things. What chair are you using? Did you use a mobility aid? Did you use armrest? Because you want to be able to replicate it next time. And also for everything you document, there's a goal associated to that, and it can help you see progress faster. All right, so we skipped one, so I'm going to go back. So timed up and go. This is another one, according to MS research, one of the best ones. I like this one because it's kind of similar to the 25-foot walk test where you're just walking a distance, but with this one, you start and end in a seated position. So this one is looking at your leg strength and your walking speed versus just one or the other. So when you do the timed up and go in the clinic, typically what that looks like is they have a chair at a designated spot that doesn't move, and they have tape where your feet are going to start at that chair, and then they have tape that is 10 feet away from you. You stand up, you walk 10 feet with or without a mobility aid, you turn around, you come back, you turn around, and you sit back down. And so again, it's looking at your leg strength, it's looking at your speed, it's also looking at your balance of how do you turn? Do you turn safely? Do you lose your balance? Does that slow you down? So this test is looking at so much. So again, at home, you'd want to use a chair that does not swivel, doesn't roll, doesn't move. For the sake of us being here right now, I'm just going to use this chair again. But you want to make sure that the chair is pushed up against a wall, and you want to ideally use that same wall every single time. So maybe don't use a wall if you know that your Christmas tree is going to go there, because then for however long you have a Christmas tree, you're not going to be able to do that test in that room. So you want to just kind of think about those things proactively. So you're going to push a chair, a sturdy chair, up against a wall, and then you're just going to walk to something that doesn't move. For me, of course, it's going to be this closet. For you, if you don't have a closet right here, it could be the doorway. It could be, I'm trying to think of different situations. If you're in your kitchen, it could be to the countertop. It could be to your TV if you never plan on moving your TV. So it doesn't matter what it is, but it should be something that is approximately 10 feet away. I don't want you to get hung up on that. It really can be any distance because you're going to repeat it the same thing next time. But let's see what that would look like. So for me in this room, I'm going to start here. Again, set yourself up for success. Be in a proper position. That's going to make it easier to stand up. Someone says go and they start the timer. You stand up. You can use a mobility aid if you want. You walk down, touch, turn, walk back, turn, sit back down, and the timer stops. And ideally, you would do that 3 times and then take the average of that time. So that is the timed up and go. We're timing you. How long does it take you to stand up, walk down, turn around, sit down? So that's the timed up and go. And again, when you're measuring this at home, what chair are you using? Did you use armrest? Did you use a mobility aid? Do you have an AFO on or functional electrical stimulation? Do you have the cyanic neural sleeve on? What was the surface that you went to? Was it the closet, the desk, the TV, a countertop? What was it? Name those specific things so that you can replicate it as closely and ideally identically as possible. So again, this is, I mentioned earlier, I was going to type out some of these things to keep in mind. So when you are documenting, there's lots of things to be documenting. The more you document, the more you write down about how that test went, the more you will see progress. I can promise you that. And so again, you can use a mobility aid. You can also document quality, not just speed. The speed would be how long did it take you to do this? Or how many repetitions did you get in this amount of time? But the quality could be, you could write down things like, my knees did not cave in at all, or my knees caved inward for 5 repetitions. Because guess what? In a month from now, your knees might only cave inward for 2 repetitions. You might do the same overall amount, but you are getting stronger, and this is how you can see it. Or another quality one, let's see for walking. For the 25-foot walk test or the timed up and go, did you trip at all? If so, how many times? Maybe you didn't trip, but did you scuff your toes or scuff your foot at all? If so, how many times? If you're using a mobility aid, if you had to guess, how much body weight are you putting through the mobility aid? 80%, 50%, 25%? Next time, or in a week, a month from now, it could be less of a percentage because your body is getting stronger. So how much are you depending on that mobility aid? As I just mentioned previously, are you wearing an AFO? If so, maybe it could be possible that in a few months you don't have to wear the AFO, but you're still able to walk that same distance. Or for some of these, it might be helpful to have someone else watching you, but how much were you bending your knee versus swinging your leg around? For a lot of these functional outcome measures that are objective, the measured ones, they're focused on timing, or how many can you do in this amount of time. And while I understand that, it really pushes speed. But oftentimes when you go faster, the quality suffers. So for me and for my patients and the way that I document, I like to include quality, because you might go faster, but you tripped more, you scuffed your foot more, and you're depending on your mobility aid a whole lot more. Did you go faster? Yes. Is that going to help you in daily life? No, we don't want you tripping. We don't want you depending on that mobility aid. So again, even if you go slower, so even if for the timed 25-foot walk test, let's say it took you 15 seconds the first time, in a month from now, maybe it actually takes you, 20 seconds. So it takes you longer, but you're not tripping as much, or you're not swinging your hip around as much. That's actually progress. Another thing to document for yourself is what time of day did you do it? Also, if you had to rate your day, is this a bad day for you, a good day, or somewhere in the middle? Because the type of day that it is for you and the time of day can, as you know more than anyone, can play a big role. It can make a big difference. So if you're doing this test on a good day, and then the next time you do this test and it's a bad day, or if the first time you did it was in the morning when you have energy, and the next time it was in the late afternoon when you don't have energy, you might see different scores, but not necessarily because you got stronger or weaker. It might just simply be the way that your MS was affecting you that day. So do your best to try to choose the same time of day as well as the same type of day. That one's a little bit harder, but do your best. And then, as I mentioned, did you use your hands on armrests? Just things to be thinking about. I know it's a lot. I know it's a lot to think about, but these are the things to be focusing on when you're writing down what you did at home during each of these tests. So I do have an app. It's a free app. It's called The Missing Link. And in there, we have it's a course, just because that's the only way that I could put it together. It's a course where you can look at all of these tests that we reviewed today. Each one has a video, and then it shares with you, and for the subjective outcome ones, there's actually a survey that you can fill out so that you can keep track over time. But really, it's up to you and your personality type. I've had Missing Link members who they use Excel and they do these tests once a month and they put their numbers in Excel, and then from there they create a chart or a graph. So you can do it that way if you're more of a visual person that likes to see, okay, over the year, each month, this is how you've done. So Excel might be a really great option for that. So it doesn't matter how you track, but just track. You don't have to do all of these. You can pick one, you can pick three, it doesn't matter. But again, it can just be a really great way for you to track at home how you're doing, especially if you're not going to be able to do these tests with your neurologist again for 6 more months or a year, especially if you're in a phase where you're not going to a physical therapist because your insurance cut you off. You don't want to lose all that progress. Again, you want to just keep tracking to make sure that you're at the very least maintaining. So these are just some things to keep in mind. And again, if you haven't done any of these, I would talk to your physical therapist or your neurologist about what are you tracking for my functional outcome measures? That is a single sentence you could ask. What are you tracking for my functional outcome measures? They will know, they should know. If they don't know, that is a very large issue. They should know what you are talking about, and they might say, oh, we're not really doing that. And then you can say, please do. Here's some that I'm interested in. Or they might say, oh, we're doing the 9-hole peg test, we're doing the timed up and go. It's possible that they just didn't tell you what you were doing. They just asked you to do something and wrote it down. So all good things to keep in mind. If you have any questions, go ahead and put those in the chat. My website is missinglink.com. I have a podcast, a YouTube channel, and of course my book and audiobook if you are interested in learning more about this type of MS strategies and tips and tricks, especially as it pertains to tracking your progress. And also, again, just a thank you to MS Views and News for partnering with me for these. I absolutely love sharing this information with you guys, and a thank you to our supporter, Viatris, as well. Okay, so I see Deanne says, thank you for this review. This was very helpful. Good, I'm glad. I really like talking about this specifically because it's something that you can do on your own. Does it require an extra person to do the timing stuff? Yeah, that would be nice, but it's something that it makes tracking your progress more accessible. It doesn't require that you go to your neurologist's office. It doesn't require that you go to physical therapy. You can just do these at home. And if you see that it's trending downward, that you're not doing great, that these numbers are getting worse, well, that just tells us that let's switch up your exercises. Well, first of all, are you exercising? If so, how frequently? Maybe you just need to exercise more, or maybe you're not doing the best exercises for you and your symptoms and your level of MS, so we need to switch those up. But if you're maintaining, that's great. If you're improving, also great. Is the app available on both Apple and Play Store? Yes. It's very concerning that some of these strategies are not being done at my PT practice. Yes, that is concerning. However, I will say, I don't work at a physical therapy clinic anymore in person, but when I did, the way that we would do this is during the very first session, so the evaluation, very rarely can we do all of these in one session. But what I would do is, before you even see me, I would give the receptionist the Modified Fatigue Impact Scale and the MSWS-12 to give to you to fill out in the waiting room before you even see me. That way, by the time you get to me, we already have 2 functional outcome measures that I'll score later, but you've already done those 2. And then during the evaluation, I would usually have the opportunity to do 2, no more than 2 of the objective functional outcome measures. But then during our session, the next session, so our first follow-up, that's where I would do anything that we didn't get to for the functional outcome measures on that first day. And then for the reevaluation day, which for most insurance companies, they require it every 30 days. Some it's every 60 days, but that's the day where, again, I'd give those forms to the receptionist. You're doing those before we even meet. And then when we meet, we're banging those out. Of those functional outcome measures that we're repeating. Will MSVN be sending out slides? So MSVN News sends out the recording on their YouTube channel. I'll grab that link for you. I'm not sure if they send out the slides. I can ask them. I'll send them and see if they will send them out to you guys. Okay, I just posted that link for you guys for their YouTube channel. That's where this recording will be. Thank you very much. This has been very helpful. Good, I'm glad. How do I find the right PT for this? Do they have to be specialized with MS? So for this tracking, if you are seeing a physical therapist that is not an MS specialist or a neuro certified or NCS, neurological certified specialist, they should still know what functional outcome measures are. They likely won't know which ones are best for multiple sclerosis. So if you are seeing a physical therapist that is not an MS specialized one or a neuro specialized one, I would just give them this list and say, hey, can we please do these functional outcome measures? I think they'd love that. If you are seeing an MS specialist, they should know these. If you're seeing a neuro certified specialist, they might know these, but again, I would just write these down, or at least the ones that you are interested in tracking, and say, hey, can we include these in our testing? And again, depending on how much time they get to spend with you, they might not be able to do all of them on one day, but they should be able to do them sprinkled out between, I would say, 2 sessions. In terms of how to find the right PT, when we're talking about just tracking, I would use the strategy that I just shared. When we're talking about exercises and are they giving you the best exercises for MS? Are they functional? Do they include neuroplasticity concepts? That's really where you do want to make sure you either have a multiple sclerosis certified specialist or MSCS at the end of their title, or an NCS, neuro certified specialist. What are the other ways to measure progress objectively? I left off my notes the dynamic gait index. So there's tons. So I'll let you watch the recording just because we're getting low on time here. But other ways beyond what we just talked about here, those objective functional outcome measures, would be with your exercises. How many repetitions are you doing? How many sets are you doing? How long are you holding the exercises for? 1 second, 3 seconds. Those types of stats and data can be helpful for you to see if the actual individual exercises are improving as well. How do you consider other, yes, thank you for asking this question. So how do you consider other health issues? That's where I would include it in the documenting part. So if you have other health issues that are impacting these tests, you would document that wherever you're keeping your notes. So that's where you could say, my GI issues are flaring today, or my vertigo was worse today, just so you know when you're repeating it, if that might be why you're seeing worse numbers, not necessarily because you're actually getting weaker or worse balance or worse mobility. Additionally, if you have health conditions that would make some of these impossible, don't choose those ones. Again, you can choose just one of these. So choose the ones that feel most appropriate to you, and then choose a day that feels like an appropriate day to do these on. If you have multiple health conditions, it's likely not going to be appropriate that you just do these once a month on the first Monday of the month, because that first Monday of the month might not be a great day for you. So those are just some things to consider if you are dealing with other health conditions. I see Michelle says, thank you, you're welcome. Any other questions, comments, thoughts, clarifications, anything at all? And again, I'll send these slides to Jennifer to see if she can email them to you. I'm not exactly sure how that system works, but this recording will be up. Sometimes they're up within a week, other times they're up within a month or so, but I did share that link earlier, so just keep an eye on the MS Views and News YouTube page and you'll be able to see this there. All right, I don't see any other, oh, one question. Is it overkill to do weekly? Is it overkill? I mean, my first thought is yes and no. No, if you're physically able to do that and these don't tire you out so much that you're then not able to do your exercises as effectively, then go for it each week. I think that's fine. Is it necessary to do them each week? No, but again, if you're very numbers oriented and you want to start seeing progress fast and you know you're exercising enough where that is possible, then sure, you could do them weekly, as long as they don't have any type of negative effect on your exercise routine. If they tire you out, so then your exercises aren't as effective, you're not able to do as many repetitions, then I don't think it would be worth it to do it weekly. Thank you again, Dr. G, another great program. Good, you're welcome. I'm so glad to hear that. Dion says, thank you. Awesome, all right, well, as always, thank you for showing up for these. Again, I absolutely love sharing this. I've shared this a few times, but it was so eye-opening. I was a brand new MS specialist. I'd been a physical therapist for about 2.5 years, but I was a brand new MS certified specialist. And I went to an MS support group and I shared an hour-long presentation. It was probably way too much, just jam-packed of basically exactly what you need to know, how to exercise with MS. And every single person there, it was about 15 people, and everyone, I walked in thinking, they're going to know all of this information already. I feel so silly for telling them what they already know. Who am I to share this with them? I don't have MS. But as I was sharing the information, every single one of them was frantically writing down as many notes as possible. And then at the end, almost everyone, except one person, said that they had never heard this information before. And it literally broke my heart, because I was like, how? You're going to PT, these are the strategies according to research that you need to be doing. How has not anyone on your healthcare team ever told you this before? And it became a mission of mine from that moment on to spread awareness of these physical therapy strategies. They're things that should be publicly available. So this is one way that I am trying to share that mission with you. Just get this information out there so that you can get better exercises and now also know how to track how those are affecting you. If insurance doesn't approve an MS specialist PT, so insurance, to my knowledge, would not disapprove of an MS specialist PT. It's just a regular old physical therapist. We just have an additional certification, but there's no additional fee to see one. So if you're going to a physical therapy clinic, they might have a regular physical therapist. They might have a physical therapist that's an MS specialist. They might have an orthopedic physical therapist, a neurophysical therapist. If you're approved for physical therapy, you can see any one of those. So to my knowledge, they wouldn't not approve you to see an MS specialized physical therapist. If you're ever in Miami and want to go to a support group, you're more than welcome. Oh, awesome. I lead one for the National MS Society. A bunch of people saying thank you. Ask for a specialist. Yeah. Yes, Maria, thank you. Yeah, and you can go to the National MS Society and they have, I'm forgetting what it's called, but you can find a doctor and you can put in that you're looking for a physical therapist and how many miles from your zip code, and they can give you some options. I will say though, they aren't aware of all MS specialists. They are only aware of the ones that are registered within their system, and not all of them are. So I know that the consortium, oh my gosh, organization that I am certified through, the Consortium of Multiple Sclerosis Centers, they are putting together something on their website that hopefully will be available soon that will give you access to all of the physical therapists that have the MSCS. So hopefully that's available soon. One really great option is call some physical therapy clinics around you and ask them, do you have an MS specialist? Unfortunately, there's very few of us, so likely they will say no, but your follow-up question can be, do you have a neuro-certified specialist? And they might say yes. That's going to be the next best bet. Dion says, maybe ask for a specialist that works with Parkinson's. Yep. Yeah, any type of, ideally they'd have that NCS, that neuro-certified specialty, or of course the MSCS, the multiple sclerosis certified specialist, because those are going to be the ones who know the research behind these diagnoses. But if none of those are available near you, then at that point I would say it is okay to work with a physical therapist who has worked with someone with MS or worked with someone with Parkinson's. They might not be staying up to date with MS in particular because they're seeing tons of different types of diagnoses, but that would be better than someone who's never treated MS. Awesome. All right, well, I will let you guys go. Thank you so much for tuning in. Again, this recording will be available for you guys. But in the meantime, start tracking, enjoy, and I'm excited to hear next month what your progress is looking like. Our next session is October 13th, and it's on managing pain in multiple sclerosis. So I will see you guys then. Have a great rest of your day and week and month, and I'll see you next time. Bye, everyone.